Your presence here today indicates that you are committed to partnering with us at the ERHA to deliver accessible, quality health care that is focused on the needs of the population and in particular of our immediate community. Ladies and gentlemen, the ERHA is fulfilling its obligation to you with the hosting of this public board meeting held in accordance with Rule 12 of the second schedule of the RHA Act No. 5 of 1994. The primary purpose of this meeting is for the ERHA to publicly account for its stewardship during 2021-2022. We welcome the opportunity to review the authority's performance, to present plans, goals, and targets for the current year, and to obtain feedback from you, our stakeholders, which would assist the authority in identifying areas for improvement. In the performance of its duties, the Board of Directors, in conjunction with the Ministry of Health's guidelines and the overall policies and priorities of the government, would have determined the strategic direction for the authority. This strategic direction is linked to the 2030 United Nations Sustainable Development Goals, more specifically Goal number 3, which speaks to ensuring healthy lives and promoting well-being for all ages. To fulfill this goal, the board determined the annual and long-term objectives and agreed upon the framework to achieve them. The work of the authority is guided by a robust management system established to improve accountability and efficiency. Performance is monitored to determine whether the stated objectives are achieved and the required corrective actions taken when necessary. We have the responsibility to ensure effective financial stewardship through value for money, financial control, and financial planning and strategy. The oversight and strategic management are administered at the board level through board meetings and committee meetings of the board's 7 committees, namely the Tenders Committee, the Human Resources Committee, Finance and Information Systems Technology, Audit, Legal, Quality Risk Management, Clinical Governance, and Ethics. In conjunction with the management and staff of the ERHA, these committees have provided strategic direction, oversight, and technical guidance to ensure the achievement of clearly articulated strategic goals. This collaboration and teamwork have established us to enhance the quality of health services offered to our community clients, transient, weekend, and vacational visitors to the Eastern region. Our clients access healthcare at the Grande Hospital, which provides secondary care services, the Miaro District Health Facility, 14 strategically located health and outreach centers, the Grande Enhanced Health Center, and the Rio Claro Satellite Dialysis Center. Ladies and gentlemen, during the fiscal periods encompassing 2020 to 2022, to ensure the efficient and effective use of available resources to achieve desired outcomes and maximize output, 4 core strategies, which included systems reengineering, cultural realignment, health promotion, and institutional strengthening were employed. Several systems were re-engineered and the exercise to establish performance indicators in relation to the authority's functional systems, processes, and structure commenced. Policies and procedures were developed, including the completion of the review of the RHA Human Resource Policies and Procedures. Under the rubric Institutional Strengthening, significant projects and procedures were undertaken to improve systems and structures, to enhance our delivery capabilities, and to provide a safe and comfortable environment for staff and clients. As many of you are aware, the new hospital is under construction, and you will be given a comprehensive report on the stage of construction and projected delivery date. At the Grande Hospital, the significant infrastructural improvements undertaken included renovation of medical laboratory, electrical upgrade, and in keeping with the National Trust to move towards true voluntary blood donation, the refurbishment upgrade of the Grande Blood Donation Center to create a warming, welcoming space. Equipment was also procured or replaced, including orthopedic drill systems for the orthopedic department, infant incubators for neonatal intensive care, and equipment for the operating theater. In addition, a mammography suite and 2 ultrasound units were installed, and there was improved efficiency of our phlebotomy services through the creation of an additional phlebotomy bleeding station. One of the key institutional projects identified in the government's policy agenda document for national development is the review and strengthening of the primary care system. Health centers and outreach centers play a pivotal role in the delivery of primary health care. Primary health care approach focuses on promoting efficient, equitable, accessible, and cost-effective approaches to address issues and factors which contribute to significant chronic life diseases in our population. As mentioned previously, the authority is responsible for an extensive geographic area in the eastern quadrant of Trinidad and is focused on strengthening our primary care system. To meet the growing demands of the community, the clinic space at the Toko Health Center was expanded and roof replacement projects were completed at this facility, as well as at Kumana and Matlot. The authority continues to build resilience in our rural communities with the procurement of generators for health facilities, the upgrade of electricals at Grand River and Sans Souci, and significant equipment upgrade, including the acquisition of ventilators, cardiac monitors, X-ray machines, and the installation of a mammogram machine at the Toko Health Center. The use of technology is also playing a greater role in improving the services designed to enhance our clients' experience. The authority has implemented, among other things, an electronic outpatient appointment system, telemedicine services for chronic disease patients, and the reintroduction of the PAN Tracker fixed asset audit software. In order to stimulate an atmosphere for high productivity and dedication, it was necessary to strengthen our human resource capabilities and ensure alignment with the culture of the organization. In this regard, the ERHA completed the reconciliation of the authority's establishment exercise, which resulted in 240 cabinet-approved positions being approved and completion of 95% of the recruitment based on approved vacant post funding. Various training programs were conducted to increase the capacity of clinical and non-clinical staff and to ensure the maintenance of acceptable standards. The authority also conducted several safety and health exercises and has ensured that plant and equipment are maintained in accordance with OSH standards. Our vision in the ERHA is to transform the current model of healthcare in the region from one of sickness and treatment to one of wellness. Health promotion is a critical strategy in this transformation, and we must educate, influence, and motivate the population to embrace the benefits of sustaining wellness. Although the COVID-19 pandemic curtailed our ability to interact with clients face-to-face, we were able to adopt alternative strategies to connect with clients. Programs undertaken to improve the quality of life included online school health programs, the ERHA Health and Wellness video services for men's health, and videos entitled My Health is My Wealth, designed to encourage clients to be proactive and focus on their health. The ERHA is on a path towards achieving baby-friendly hospital status and has established a baby-friendly hospital initiative to implement the 10 steps to successful breastfeeding. In the performance of our duties at the ERHA, there is a continued quest for operational excellence. We have adopted an organization-wide management philosophy that quality improvement is the responsibility of every employee. In this regard, we have fostered a quality improvement culture through quality circles, the operations of quality monitoring committees, and sensitization on adverse events. The trials we faced during the last 2 years in coping with the COVID-19 pandemic have taught us that as a community, we can overcome many obstacles and achieve realistic outcomes. The ERHA acknowledges our members of staff as our most valuable resource. We also acknowledge and celebrate the lives of the staff members lost due to COVID-19. I must take this opportunity to recognize and thank all members of staff who worked tirelessly during the trying days of the COVID-19 pandemic, and in particular, the teams of healthcare professionals and the support staff from the ERHA who delivered outstanding healthcare to patients. To all staff who enabled us to operate a parallel healthcare system as we adjusted to the new normal, I thank you on behalf of the ERHA Board of Directors and the citizens of the country to whom you provided such exemplary, caring service. I wish to take this opportunity to thank the CEO, executive management, clinical, and all other staff members of the ERHA family for putting our clients first. It is through your caring and commitment that we have been able to achieve first-rate delivery of healthcare services in the Eastern region. Ladies and gentlemen, the ERHA team remains committed to excellence in healthcare and service to people of Trinidad and Tobago, and in this regard, we continue to serve you. Thank you.